Well, hi everybody, this is Dr. Schroeder with this week's video introduction to week number 2 of our course in evidence-based practice. And we got up to a really good start in week number 1. Week number 1, the main task, well, besides getting to know each other and doing our introductions, was to identify a problem pertinent to some form of nursing practice, and then to develop this PICO statement. And again, of course, everybody knows by now that is your patient population, your intervention, comparison intervention, outcome, and time frame. Um, and most of the discussion in class was a discussion of how to refine this PICO. Now, in the real world of evidence-based practice, the evidence-based practice really starts with this PICO statement. PICO is the equivalent of a nursing research question in a nursing research study. It is the ultimate question that you want to answer and that you're trying to address that encapsulates all those 5 components. And all those 5 components need to be well defined within that PICO statement. It doesn't have to be lengthy, it just has to be clear, concise. Outcomes need to be measurable and specific. And everything relates back to some form of usually an improvement in patient care, something that we can say that there is evidence-based practice, or that the evidence shows that this new intervention that we're proposing is the best practice, or the one that would work the best in a given situation, whatever your patient care situation is. That's really the focus here. And so it is common in evidence-based practice teams to take some time to really develop these and to sort of go through several drafts and to refine them as new evidence is found. So I've given each of you feedback. I think that I gave everybody feedback in class on their PICO. I gave a lot of feedback this week, and I won't say that I will give this level of feedback each week of class, but in this first week, it's important to get off to the right start and important to get that feedback to make sure that you get that PICO statement well written, because if you don't have a well-defined PICO by the time you get to your week 3 evidence-based practice paper, it's going to be difficult. A PICO statement is, if I use the analogy of if you've ever built a fence, I mean, you want to get that first row of bricks just right, because if you get that first row of bricks right, everything will line up perfectly. If something's a little bit off, what happens is that as you go and build the thing, it just gets worse and worse. And so that's why having those a clear idea of your intervention and your outcomes in particular is really important, and a description of the patient population that you're going to be using for that PICO. So again, take that feedback that I gave you in week 1 and use it to refine your PICO. Your week number 2, we're going to start a discussion of how to find evidence and doing a keyword search, and you're going to propose a keyword search strategy. And again, each one of these weekly discussion questions that you're doing is really meant to help guide you and to build that evidence-based practice paper that you're using. So remember that the work that you do in these discussion questions is ultimately going to be reflected in that paper, where it all really comes together. Finding keywords or identifying a keyword strategy is important, because nearly all the evidence-based practice evidence that we find is located in professional databases. It's not found in Google, and it's not found in Yahoo. And because of the way that these databases work, their search strategies are, compared to Google and Yahoo, they're rather rudimentary. All they do is they search for keywords. They don't try to anticipate what the words mean. They don't try to second guess you as to what you're really looking for. They're simply looking for certain words, and they match up words. And so identifying what words you would find in a study is really important. That's how you find information. I've had many students complain that it's like, well, I searched for information and I couldn't find it. I just can't find anything in the database. Well, really, there's usually the problem is that they're not using really correct keywords. You can't think in terms of Google. You know, if Google is going to, for example, if you're do a Google search for Chinese restaurant, it's going to figure, oh, you're looking for Chinese restaurants, probably the best rated ones and the ones in your neck of the woods. And so here's a list of Chinese restaurants in your area. That's not really how these search engines work. If you're looking for, to do the search terms of Chinese and restaurant, it's not going to figure that you're looking for Chinese restaurants. It's just going to look for articles with those 2 terms in it. or that, and depending on how you do your Boolean search strategy, it may include articles that have both of those words, or maybe just one or the other words. And so the combination of words that you use and the spelling and all these things is very important. And that's why in week number 2, you're going to be identifying your search strategies so that you can find that information. Also in week number 2, you're going to be having a interview, if you haven't already, an interview with a librarian. There was a question in the class, is it okay to use do you have to have a face-to-face interview with the librarian? No, a phone interview is fine. A phone, or I use internet chat a lot when I talk with my librarians and with my consultants. So, whatever form of interview you select is appropriate. It just has to be real time and either phone or in person. It can't just be email exchanges back and forth. It needs to be you actually need to meet with your librarian. There is posted in the class the Sacred Heart University library resources. They are excellent librarians. They've been doing this for a long time. Jeffrey over in the library is very well versed in what everybody needs. But you don't have to use Sacred Heart University. If you are working a medical center that has a medical library, you can go down and just spend some time and make an appointment and go see the librarian there. That is it's a fairly simple assignment. And so please follow the rubric or refer to the rubric. They will be due no later than Sunday of week number 2. So I'm recording this on Sunday of week number 1, so a week from today, or a week from probably the day that you see this video. So those are the 2 things that are due this week: the discussion question with your search strategy and the number of articles that you found in each of the databases that you use these search terms for. A good search should have a response rate of about roughly 50 to 100 articles. If you can get a search that comes up with 50 to 100 articles, you probably have a really pretty good search. If you have any fewer than that, if you only do a search and only come up with 1 or 2 articles, you're probably limiting your search terms a little bit. If you come up with 1,000 or 2,000 or 3,000 articles, then you definitely have too broad of a search. You need to choose more terms to narrow that number down. 25 is a good number. 25, 50, somewhere in there is kind of sort of a sweet spot for the number of articles that you should have. You're not going to review all those articles, of course, but you need to have a sort of a selection of articles. And so you want to get that number down to probably about as close to 25 or so as you can. So I'm here available to answer any questions. I hope everybody has a great week. If you're enjoying the World Series, if you're a baseball fan, if you're a Boston fan, you're probably really happy right now. So I hope that everybody is doing well. Again, if you have any questions, let me know, and I'll see you in the discussion forums.